Hello and welcome to ETCIO video interviews. Today we have Mr. JP Dwivedi, CIO, Rajiv Gandhi Cancer Institute and Research Center to talk about his work towards digital. Welcome, sir.
Thank you, Selvi.
So let's start with your role as a CIO. After the sudden pandemic outbreak, as a CIO, how did you prioritize your IT initiatives to ensure business continuity?
So very first thought, Selvi, came to protect whom? To protect the patients, their attendants first, protect our employees next, and then protect supply chains. And we oriented all our efforts around these three protects. So how to protect the patients? Give them the means to consult our doctors from home, minimize their need to come here, minimize the crowding. Protecting the employees means allowing them to work from anywhere. So that meant having a lot of infrastructure, laptops, VPNs, secure connections, ability to allow them to work from home. And then a lot of policy related decisions also, because we are a hospital. So working extended shifts, making arrangement to declutter the workplace, and then protecting supply chains, setting up right reorder levels and everything to have 6 weeks of supply rather than 3 weeks to ensure that the essential drugs and supplies, etc., are not in short supply and we are able to serve the patients seamlessly, smoothly. So we oriented all our efforts around these three areas.
Right, sir. So how is your research center investing in the robust IT infrastructure and applications?
So robust is a very big word and it has a very wide meaning. What we did, we prioritized our needs in the same way as Maslow did for the hierarchies of needs. So very first level is infrastructure layer. Then the ERP layer, the background functions. Then HIS layer, then electronic health record layer, and then digital technologies layer. And we just progressively built the strength around these layers. Very foundation is your infrastructure. You should have sufficient hardware and network, medical grade network to support the IT function that is pervading the institute. Enough servers is not enough. You need to have virtualization at the server level, at the network level, so that we are cloud ready anytime. We can expand. More and more applications could be deployed at a short notice. Then comes to security. Applications have to be secure. Data needs to be protected from being stolen, hacked, destroyed, deleted, and falling into unauthorized use. So we built strength around this layer. And then coming to ERP. So we subscribe to one of the best ERP systems in the globe. And then integrated this to our hospital information system to ensure seamless working. And we deployed our finance and accounting, materials management, payroll, and the asset management system on this ERP. Then we moved on to the strengthening of the HIS function. HIS basically takes care of the patient management, facility management, ward management, bed management, and the revenue cycle management. So robust HIS system is actually a solid bedrock to roll out any digital transformation. And then we moved on to the electronic health record layer, which is a single longitudinal health record to ensure continuity of care for the patient. All the clinical notes, all the orders, all the reports, lab results, investigation reports, x-rays, images, CT, MRI, etc. Everything being available for doctors viewing and making best decisions in the interest of the patient. And finally, the utopian layer is the digital technologies layer. So there we look at our website, our interface to the external world, then using the AI ML technologies to strengthen our investigations, making clinical decision support system, analytics to create dashboards that help our doctors and management making decisions. So these are 5 successive layers that we built one on top of other, and not exactly sequentially, but yes, the attention has been building one after other. So that is how we moved on with our digital transformation journey.
So talking about optimizing the, how are you optimizing the electronic health records and patient engagement?
So electronic health record basically has 2 components. If you look at it, one is the computerized physician order entry, we call CPOE. That means prescribing medicines, ordering the lab test, radiology test, etc. online. And the second is the clinical notes, the documentation. And both are equally important, and both are very time consuming if these are not made customized for the practice, content rich, fit to use. This is the biggest mistake people make, offering vanilla system and forcing doctors to use it. They will regret it, they will resist it, they will not use it because it is eating a lot of precious time that they are supposed to give to the patient. So make the system context sensitive, content rich, and just a few clicks and the prescription is done. There are a lot of ways. There are treatment protocols for different diseases, sub-diseases. Let the doctor choose. Every doctor has a practice. There are favorite tests and medicines and everything. Not only just medicine name, but have the average adult dose, have the frequency, have the route, everything all preset so that without n number of clicks, the order is quickly gone. And then coming to the documentation. So a structured documentation, having clinical note templates, specific templates to specific diseases. It is very helpful because that will help the analytics also in future. And third and final thing is have the diagrams with annotation facility so that doctor is very clearly able to depict. One picture speaks more than 1,000 words. There is a saying. So once all these are facilitated, it is helpful for the doctors to actually document it, and it takes lesser time than actually doing everything on paper. Clinical productivity is ensured, and then they adopt the system happily. Second is that, yes, whatever order entry they are making, it is to make sure that this is followed through and that order cannot be adulterated at any stage afterwards until the final execution. So these are the points that we kept in mind while implementing our electronic health record system.
Right, sir. So as a during the COVID, patients had different expectations. Everything changed. So how were you as a digital leader embracing telemedicines and telehealth visits, virtual doctor consultations at the research centers?
Selvi, when we started all this, we were in a very primitive stage. Nobody was ready in the country for that matter. And we thought that, we either perform surgery or infuse chemotherapy or do the radiation therapy, and all these require touch and feel. But then there are a lot of visits in between that actually patients can avail without physically coming here. Patient can explain the situation. There is a problem. Doctor can intervene remotely, can advise. certain common medicines could be prescribed, or a local doctor can perform certain minor procedures. So all this need, this came when we confronted the situation of COVID. We did not wait for a super duper system to be built. What we needed was to help our patients quickly. So we just enabled the payment gateway connected to our website, asking the patients to just pay for the consultation as a general item. And then we settled that in the background. We put in coordinators in front so that they can coordinate video conferencing. They can coordinate the schedule of the doctor and the patient and arrange the consultation, and then email the prescription to them. So stitching a quick solution which worked for the patient. But then within 3 months, a full-fledged, fully integrated app was in place, which is back-to-back integrated with our EHR system and seamlessly working. Not only for the patient, we built the app for the doctors also. When doctors are on the round, they can just quickly put the note online, and then it is all going into the database. Patients want a lot of services now at home. They want a facility to register themselves online, then consult a doctor, and then when a doctor has prescribed, then the medicine should reach home. Maybe certain tests are prescribed and patient wants to get the test done from our laboratory, then we should be able to send someone to collect the samples, conduct the test here. We have not reached all those stages right now, but at least we are at a stage where patients can register themselves, they can request online appointment, they can pay online, and then avail the video conferencing service. But we have a lot of other functions in the pipeline that we are planning to build. And of course, patient can see their bills, their reports, the results, etc. Their personal health record is there on their mobile now, and it is available, accessible 24/7 to them.
Right, sir. So talking about the security, so what are the security investments to ensure such patient interactions meet privacy, security, and other regulatory requirements?
So I will only say that we pay enough attention to the information security aspects. Security is a paradigm that is constantly changing. Now that, castle and moat time has gone, data is now pretty much accessible from anywhere. Our patients are in every corner of the world, and that perimeter security will not work. So there are a lot of other security considerations which have come into picture. So application level security, web access firewall, access policy manager, lot of other parameters are in place. So we have put in the products and tools and technology and processes in place to ensure that our posture is strong enough to deal with the threats. But nobody under the sun can say that we are 100% secure, because this is a constantly changing paradigm. So we have to be on our toes, and we have to be very vigilant to look after the security aspects. Of course, I will not go into details of what products and solutions we have put in, because that will call for the threats in itself. But we are reasonably prepared, and we are very much aware of this aspect.
Right, sir. So one last question, sir. How do you see the future of digital health at Rajiv Gandhi Research Center, and how is it driving the future for your organization?
So I can say with a lot of reassurance and a lot of satisfaction, 10 years back when I started, we were a support service. Now we are counted as enablers. The future is to become the driving force, to actually open new horizons, to invade in every aspect positively and positively affect patient safety, clinical outcome, cost of the treatment, and patient experience. All these 4 areas positively, and we are very actively working using the latest technologies, AI, ML, data analytics, and whatever is available to the world of the healthcare today. And we don't work in silos. So like all professions, we also have our networks. So there are fellow CIOs. We keep in touch. We keep talking to each other, keep discussing. And your forums like ETCIO, we are thankful to all of you community people who facilitate and enable our frequent meetings. So we are working with each other and trying sincerely to actually elevate the landscape of digital transformation, at least in healthcare arena.
Thank you so much, sir, for joining in.
Thank you.